Hello, my name is Katie Whelan, and I'm going to be talking about virtual reality used in cognitive behavioral therapy and exposure therapy for the treatment of phobias. So, what is virtual reality? Virtual reality is the use of computer technology to create a simulation of a 3D image or environment that can be interacted with. The user is immersed and able to interact with 3D worlds. Virtual reality stimulates senses such as vision, hearing, touch, and possibly smell. So what does virtual reality technology look like? The most common form would be the head-mounted display or HMD. Many companies have produced versions like this, such as the Oculus Rift, Microsoft HoloLens, Samsung Gear VR, Google Cardboard, Magic Leap, and so on. Virtual reality has been around since the 1950s. In 1957, filmmaker Morton Hiley created the Sensorama, which was a large booth-like machine that gave users the illusion of being in a 3D world. Computer scientist Ivan Sutherland created the first head-mounted display in 1968. Since then, the VR headset has evolved, and in 2010, Palmer Luckey created the first prototype of the Oculus Rift. So how does our brain process images? Our brain is designed to pay attention to what's new in the environment. When light hits the retina, the process of sight begins. The information from the retina is sent via the optic nerve to other parts of the brain, which then processes the image and allows us to see. VR headsets have two LCD displays, one per eye. There is a lens placed between your eyes and the pixels. The lens focuses and reshapes the picture. This creates a stereoscopic 3D image by angling the two 2D images to mimic how our eyes see the world. Our brain is then tricked into thinking that we are in the environment. A phobia is an irrational or excessive fear of an object or situation. It involves a sense of endangerment or a fear of harm. When we are afraid, the amygdala in our brain is more active. The amygdala's main role is to process emotions. Conditions such as phobias, PTSD, and anxiety have been suspected of being linked to abnormal functioning of the amygdala. Social phobia involves a fear of social situations. Agoraphobia involves a fear of being trapped in an escapable place or situation. Lastly, specific phobia involves a fear of animals such as dogs or snakes, something medical such as going to the doctor. The natural environment would be water or lightning, or situational. In 2017, the National Institute of Mental Health carried out a survey and estimated that 12.5% of US adults experience a specific phobia once in their lives. The most common specific phobia is arachnophobia, which is a fear of spiders, then acrophobia, which is a fear of heights, and finally aerophobia, which is a fear of flying. So what are the different types of therapy? Cognitive behavioral therapy aim is to help you manage your problems by changing the way you think and act. It encourages you to talk about how you think of yourself, the world, and other people, also how what you do affects your thoughts and feelings. With exposure therapy, patients experience what they fear in a controlled way and in small doses. How is virtual reality used in therapy? Virtual reality exposure therapy combines cognitive behavior therapy and exposure therapy. It allows the patient to face their fears in a safe, controlled environment. They are immersed into a simulation that is aimed at their particular fear. They attend multiple sessions until they feel indifferent to what they fear. There was a case study in 1992 where a 32-year-old woman with aerophobia tested VR exposure therapy to overcome her fear of flying. The virtual scene was a stimulated city running on a Silicon graphics computer. The results showed that throughout the experience she showed signs of high level of anxiety at the beginning of each session, and as the session progressed, her anxiety levels gradually dropped. To further investigate the transfer effect of VR therapy, she was flown in a helicopter at a low altitude over a beach in the Gulf of Mexico. It was reported that she became more comfortable with flying and experienced less anxiety. One conclusion is that when subjected to virtual phobic invoking situations, the subjects exhibited the same responses that would be exhibited in a real-world situation. Virtual reality exposure therapy is beneficial for the patient because they get to face their fears in a safe environment. Many patients have difficulty imagining their fears and express strong aversion to experiencing real situations. VR exposure therapy offers a halfway point. The aim of exposure therapy is for the patient to be exposed to what troubles them until they become indifferent to it. One benefit of VR therapy is that it allows the patient to try the therapy without as much anxiety. They can experience the phobia without having to travel to the location. There is confidentiality for the patient. The therapist has full control over the situation. The therapy is more realistic and effective. Sessions can be repeated in order for the patient to conquer a small portion of their fear. However, to prevent risk, certain cautions need to be taken. According to Stani, those at risk for psychological harm are primarily those who suffer from panic attacks, those who have serious medical problems such as heart disease or epilepsy, or those who are taking drugs for major psychological effects. Therefore, patients are asked questions regarding these situations before the procedure. Limbix is a company that's partnered with multiple colleges that carry out research on phobias and VR. Limbix offer a pack that contains a tablet, VR headset, charger, docking station, immersive environments, real-world 360 footage, and interactive scenes. They offer an at-home exposure therapy experience where the user can face their fears in a safe environment and in their homes. So why is VR exposure therapy not commonly used? One of the main reasons why VR is not commonly used in cognitive behavior therapy and exposure therapy is because of the cost factor. Secondly, there is a lack of research on how effective virtual reality exposure therapy is. Thirdly, it is new technology to many people, so training would be required. According to Variety.com, virtual reality revenues are estimated to reach $7.17 billion at the end of the year. According to a report by Greenlight Insights, these figures will grow to $75 billion by 2021. According to Statista.com, these figures are estimated to grow to $21.5 billion by 2020. So what is the future of the virtual reality industry? While certain statistics offer different insights on the future of virtual reality, it is certain that it will continue to grow. Virtual reality has grown immensely in the entertainment industry, but there are studies carried out that shows its growth in other industries, such as medicine, therapy, sport, fashion, and so on. Thank you for listening.